What high thyroid antibodies mean. So, have you been told that you have high thyroid antibodies? And after seeing them high on your test results, you were left wondering, well, what does that mean? And what can I actually do to reduce them? So let's discuss thyroid antibodies today and what it actually means for your health. So hello everyone, I am absolutely thrilled to be here. For those of you that don't know me, my name is Michelle Cooke. I'm a period and hormone naturopath and natural fertility educator and an emotion release technique practitioner based in Melbourne, and I see patients both online and face-to-face. And I help women struggling with their menstrual cycles have easy, pain-free periods, balanced hormones, and emotional well-being. So I'm the founder of Reproductive Wellness based in Melbourne, as I already mentioned. I am a little bit rusty today because it has been a little while, so the nerves are going. But we're just going to push through anyway because I am excited to talk about the content. If you have any questions or comments as we go through, be sure to pop them in the comments box down below and make sure that you hit the love hearts and the likes so that I know that you're enjoying what we're talking about today. So let's get started. So what are thyroid antibodies? So that's a good question. So basically there's 3 different types of thyroid antibodies. So we've got TPO-AB. I like to kind of abbreviate them because they're quite lengthy. So that stands for thyroid peroxidase antibodies. And then we also have TGAB, which is our thyroid globulin antibodies, and then we have TRAB, so that's the shortened version. That's the thyrotropin receptor antibodies as well. So thyroid antibodies are basically produced when the immune system is triggered, and it's mistakenly thinking that it's producing antibodies against its own self. Basically, it's not recognizing your tissues and cells as yourself, if that makes sense. It thinks that there's an invader there. So the immune system is on high alert and it doesn't recognize its own tissues and organs. So i.e. your thyroid gland in this instance, it's thinking, what is that thing? Is it an intruder? What's happening? And then the immune system goes into that defense mode. So it mistakenly actually attacks your thyroid cells. So that's pretty scary, isn't it? So what would high thyroid antibodies actually look like on a pathology test? So let's discuss that. So first of all, we need to remember that pathology ranges on a pathology blood test, for example, or any type of test really that you get run of the mill through a doctor that you're sent away to get done, are always very broad. And they're too big of a margin, way too big. So we always have to think about what are the optimum levels. So within that really broad range, what are the optimal levels that we need to achieve to be in good health? So you can still feel awful if your wheels have fallen off the wagon outside that optimal range, which is that smaller, tight range. You can still have symptoms and all that kind of thing and feel really bad. But of course, you're going to feel way worse if it's completely out of the range, whether it be at the higher end or at the lower end. So when we think about sort of thyroid antibodies, they're a little bit different. So generally on the pathology test, it will tell you that it needs to be under a certain range. So as long as it's sort of under that, they're happy with that. If it's over that, that's when it's sort of cause for concern. But we need to remember as well, even if it is below that allowable level, it still could potentially be too high and sort of not within an optimum range. So a naturopath always looks at that as well and sort of says, well, are those antibodies actually within an optimum range still, even though they're below that certain level? And the actual level will depend upon the provider that you've gone through. So each pathology company has a different range. So I can't really provide a number for you because they're all different, and it just depends upon the lab that's actually doing the test for you. So if it is above those optimal levels, a naturopath would actually sort of be alerted to that, and sort of it indicates that there's some sort of immune activation that's going on. And it's something to actually monitor and keep in mind, and making sure that it doesn't actually go above those optimum levels, above that allowable reference range level. So yeah, that's another thing that we look at as well. So we just kind of keep an eye on it when it's under the reference range still and above those optimal levels. But when they're high, of course, that does require further investigation. So this is when levels are sitting above that reference range in that pathology lab, and it varies depending on the lab, which I spoke about before. If it's a little elevated, this sort of highlights that it's in those initial stages of that autoimmunity. So kind of in stage 1. So it's like gearing towards autoimmune disease. That's kind of step 1. Obviously, the higher the antibodies, the more inflammation that's present there. And this will generally mean that you've got things like Hashimoto's thyroiditis or Hashimoto's thyroid disease, or you might have Graves' disease or something like that, both of which are autoimmune thyroid conditions. So what actually happens when you have high thyroid antibodies above the reference range? So this is when your antibodies will really kick it up a notch, and they will actually start to attack your thyroid gland, so much so that it can kill off the hormone secreting action of that thyroid gland. And in replacement of that, with the tissue that's damaged, that actually forms scar tissue, okay? So it's unable to actually produce hormones properly. So this leads to a dysfunction, obviously, then in thyroid hormone production. So that could be overproduction of hormones in terms of the thyroid, and that will generally happen with things like Graves' disease, or it might be more of an underfunctioning, which can happen typically with Hashimoto's disease. However, sometimes with Hashimoto's disease, it can actually, the pendulum can swing back and forth to underfunctioning back to overfunctioning and overproducing hormones. So there can be a bit of a swing there. Okay, so, and this, like when you get to that point of autoimmune thyroid disease, so whether it be Graves' disease or Hashimoto's disease, for example, generally speaking, this usually indicates that medication is needed there to help sort of manage your thyroid function, because it's unable to sort of produce hormones properly and operate and function on its own. But it really depends case by case and what's sort of happening with that person, whether they actually need that medication or not. But that's generally the case for the majority of people. So the symptoms will actually depend on what's actually going on for you. So a Graves' disease patient will look very differently to a Hashimoto's thyroiditis patient, for example. But this is just to give you an idea of some of the symptoms you might be experiencing when you've got those thyroid antibodies present. So there might be things like goiter, which is an enlargement of the thyroid gland. There could be weight gain, or there could be weight loss. There can be things like fatigue. There can be constipation or diarrhea, depending on whether your thyroid is overfunctioning or underfunctioning. There can be dry skin, but this might not be the case. There can be gut issues as well, and generally speaking, this is usually a causative factor or contributing factor or driver to that thyroid condition. So it's really, really important to look there. There can be a rapid heartbeat, but not always, depending again on the over and under functioning of the thyroid. There can be things like anxiety, depression, intolerance to heat or cold, because remembering that your thyroid actually it's regulating body temperature. That's a big sort of, it's like the thermostat of the body. So that's one of the roles, one of the many roles, and it regulates metabolism as well, which is why it leads to things like gut symptoms, diarrhea, constipation, all those kind of things. It can also lead to things like insomnia, hair loss, muscle weakness, and menstrual cycle issues is such a huge one when it comes to thyroid. So that could include anything like PMS, irregular periods. Your periods could be really heavy or they could be really light. So it kind of depends what circumstance is happening alongside those thyroid antibodies. So let's talk about causes and contributing factors. So there can obviously be genetics can play a role as well. So autoimmune disease can typically run in families, but it doesn't necessarily mean that it will present for you. It just depends on what you're exposed to in your life. So are you exposed to certain environmental toxins? Are you exposed to chronic long-term stress? Are there nutrient deficiencies? All these things can switch on that genetic potential as to whether those conditions and thyroid antibodies and stuff like that will present for you. Diet. So this is a big contributing factor as well. So a poor diet that's deficient in vitamins and minerals that you need for your thyroid to operate and function in a good and proper manner. And consuming a diet that's high in inflammatory foods as well. Adrenal dysfunction. So our adrenal glands sit on top of our kidneys and they help us adapt to stress and they give us energy. So if you've got adrenal dysfunction, this is usually due to chronic stress and it's been long term, or there might be trauma there as well. So that can definitely impact thyroid health as well. Toxins is another one. So heavy metal exposure, chemicals that you're using in the home and on your body, occupational work exposure as well. So whatever chemicals that you're exposed to at work, that can also contribute as well. Another one is gut issues. So we kind of touched on this. So things like leaky gut and dysbiosis. So there's an imbalance of good and bad bacteria in the gut. There might be an overgrowth of bacteria, parasites, fungi, viruses, and all those kind of things cause havoc in the gut level. And we have to remember that the majority of our immune system is in our gut. So, and that's such a big driver, remembering that antibodies are produced in response to the immune system being on high alert. So that's why we need to address whatever's going on there. And poor digestive function as well is going to be a contributing factor. If that's a bit sluggish, bad bacteria is not being shifted through properly, food's not being digested properly, it's fermenting in the gut and it's causing all those bad bacteria and nasties to have a field day in the gut, and they're just overgrowing and having a little party down there, much to your disgust. It's not the good kind of party anyway, is it? Okay. So what can be done to reduce thyroid antibodies? So there's so many things that can be done here, and that's really where naturopathic medicine really, really shines, because it is actually possible to reduce your thyroid antibodies levels. It really is. And basically all the things that are implemented, so things like working on diet, lifestyle, herbal and nutritional medicines, they're all really important in addressing and bringing down those antibody levels. So I would like to share 2 tips with you today to actually help bring those thyroid antibody levels down. We do have to remember though, this is just 2 of many, many, many things that would need to be addressed, but it's a good start and it's something that you can implement right away. So my first tip would be removing gluten. So gluten is a protein that's found in grains such as wheat, rye, barley, triticale, spelt, kamut. All those types of grains contain gluten, and it's commonly found in products such as bread, pasta, baked goods. You can find it sneaking into sauces and condiments and things like that as well. So just be mindful of the labels there. And it's linked to causing inflammation in the body. So particularly in the gut, you'll find that. And it's causing damage and irritation to that gut lining, leading to leaky gut, okay? So remember, the gut, as I mentioned, is a huge driver and contributing factor to those thyroid antibodies being present. The immune system's not happy, and your body's going to let you know about that, that's for sure. So what I would suggest is switching to gluten-free foods, and that's so easy these days. There's so much more selection than what there used to be. You can easily switch over to a gluten-free bread, a gluten-free pasta. You can look at your sauces. Most of them have on the front if they're gluten-free as well. So just switching through to all of those instead would be a really, really good move, just to help try and lower those thyroid antibody levels. And you really can't underestimate how key removing that is. I know it can be a big change for someone who's used to eating that all the time, but you need to sort of ask yourself, is it really worth eating that and having those raised thyroid antibodies and feeling awful? And the answer is no. Like, if nothing changes, then, nothing changes. You need to actually implement some change for positive change to come about. And I know it can be hard, but it's super, super important for your thyroid health. The second tip that I would recommend is to be drinking filtered water. Really, really, really important. Tap water contains so many toxins and chemicals, so things like chlorine, fluoride, heavy metals, you name it, it's all in there. So fluoride and chlorine, for example, are known as halides, and they are really bad news when it comes to the thyroid, because they actually block the uptake and absorption of iodine for the thyroid gland to function well. So this is a real problem, okay? Because if you don't have enough iodine, you're not going to be able to make your thyroid hormones properly, and your thyroid's just not going to work as well. So we spoke about heavy metals being found in tap water as well. So it's pretty much a double-edged sword there, because not only do you have those halides that I spoke about, but you've got the heavy metals as well. And both of those are contributing factors towards having thyroid antibodies, remember? So this is a good way to address it. So the way that you can do that is to make sure that you have a water filter at home. That also removes fluoride as well. Not all of them do. Typically you need the double canister for that to happen. So just make sure that you do that. If it is sort of out of your budget, that's okay. Consider buying sort of pre-filtered water. So you can get a brand called Puro that's available at supermarkets, and at least that's kind of filtered for you. It's a good start while you put some money by to get a good filter at home. Okay. So we spoke about this before, so we know that these are good recommendations, so what I've spoken about today, but there is a lot more to it, and we need to remember that. So I would actually recommend actually making an appointment with a naturopath that specializes in hormones, like myself, so that we can deep dive into your individual circumstances and what you're presenting with and what your antibody levels are like. And then we can look at things like, what are your nutrient levels like? What is your gut like? And we can do some gut testing. So we can do gut microbiome testing, for example. So that looks to see if you've got any bacteria, parasites, viruses, fungi, fungal overgrowths. It looks at sort of the state of your gut, whether it's leaky, whether it's inflamed, whether it's functioning well. It's very, very comprehensive. And that's such a huge driver. I know I've said that so many times, but it's super important. I would also be looking at a full thyroid panel as well. So not just TSH, which the doctors commonly test for, and that's not their fault, by the way. It's Medicare, pulling the strings on that side of things. So they're just doing the right thing and trying to abide by that. But a full thyroid panel should really be TSH, T4, T3, spot urinary iodine, and also your thyroid antibodies as well, and if possible reverse T3 as well, just to give us a complete picture of what's happening with the whole thyroid there. The other thing I would typically look at, I'm not sure if I mentioned this already or not, but nutrients. So nutrients that are crucial for thyroid health. So, looking at things like zinc levels, comparing that to copper and seeing what those levels are like there. Also looking at things like vitamin D, which is extremely important for thyroid health. And also we can't forget our lovely iodine as well. That's super important. And iron. Iron is a huge one for thyroid health as well, and it can contribute to high thyroid antibodies as well. If we don't address the iron deficiency, it can be very difficult to bring those thyroid antibodies down. And your thyroid needs an abundance of iron to function well too. So that's a really important one to look at. Adrenal testing as well, because we can't underestimate. Remember, stress is a contributing factor towards having thyroid antibodies and thyroid disease. So we need to look at that. So I would typically, at the bare minimum, look at cortisol, morning levels of cortisol in the blood. If people can't afford, there's a salivary test that you can get done, and that's probably the best way of testing it. And that will test your morning cortisol, your midday cortisol, your cortisol at 4 p.m. and your evening cortisol as well. So it gives us an idea of the pattern throughout the day and what's going on there. It's a lot more comprehensive, but if it's not affordable, a snapshot of what what your adrenals are like is just to look at the morning cortisol in the blood at the bare minimum. And other testing will really depend upon what's happening with that individual. So if they're experiencing, period issues as well, obviously we'd be looking at, what are the ovarian hormones like, estrogen, progesterone, testosterone, all those kind of things. So it just really depends what you're presenting with. So are there any questions before I sort of wind up? I'll just have a quick look on Facebook. I don't think there's any there, but if you're a bit shy as well, you can always put it in the comments afterwards, and I'd be more than happy to answer that for you. That's not a problem at all. And if you would like support with your high thyroid antibodies, or you're having some issues with your thyroid health, I would really love to help you. So if you're watching on Instagram, I actually have a link in the bio. So all you have to do is go there to click to book an appointment. If you're watching on YouTube or Facebook, I'll pop a link down below so that you can easily do that. And yeah, we can kick off 2025 on a good start for you and work on your health. Remember that all of my Instagram and Facebook lives are on my website, on my blog. So if you've missed any, or you want to go back and look at some juicy topics that I've done in the past, they're all on my website, which is reproductivewellness.com.au/blog. Or if you're watching on Instagram, I've got a link in my bio towards that as well, so you can just click on that. And I would like to thank you so very much for joining me today. I've really appreciated you coming along for the ride and listening to me chat about thyroid. I just love this topic. It's probably one of my favorites, to be honest. And yeah, if you're watching on my YouTube channel, be sure to like and subscribe so that you don't miss any future videos. And I will be here live every Wednesday, 6:30 p.m. Australian Eastern Standard Time, talking about anything menstrual cycle related, periods, hormones, emotional health, reproductive health, women's health, all those kind of things. So I look forward to seeing you next Wednesday. I love that. Yes, I agree. It is so important to educate people on this. Yes. I very much agree with that. I hope you have a lovely evening, and I will see you next Wednesday. Thank you so much. Bye.